Hi, good day. The YMC Education Series is free and open to the public. We encourage you to spread the word and invite friends and family to participate. We host approximately 6 to 8 of these a month, varying in all types of topics. This program will last about an hour. You may find that you have questions. Feel free to put them into the chat box. Denise will be able to get to the questions at the end of our talk, but sometimes she's able to see the chat during the talk, so we can get some of your questions in there. Thank you again for joining us today. I would now like to introduce you to Denise. Denise will be talking today about heal hip pain naturally. And today, she'll be discussing some of these. So are you unable to walk or exercise like you used to because of hip pain? Is laying down on your side causing you pain? Do you sit a lot and then have hip pain when you stand up and begin walking? Are you wondering if your pain is from your hip joint, hip muscles, or your back? Then this workshop for you today is for you today. All right, with that, I'd like to welcome Denise.
Oh, that was quick. Okay, thanks, Pam, appreciate it. Hi, everyone. Looks like everybody's muted. That's great. We have a couple people still on video. If you don't want your face recorded, you might want to turn off the video. As Pam said, it's much easier on a webinar to do the questions at the end. So go ahead and put them in the chat box. Pam, are you staying on the whole time?
Yes, I'm right here. I'm just don't have my video on. Do you need me?
No, that's fine. No, I just want to make sure you're going to still be here. So if you see something in the chat that I need to address
I'll be
right
monitoring
away.
the chat. You got it.
Yeah. Okay. Otherwise, I'll get to it at the end. Okay. All right. Wait, I got to get into my PowerPoint. So give me a second here. Oh, I think you might need to make me, in order to share my video, you might need to make me a host or something like that. Oh, wait a minute, share screen. Oh, there it is. Okay. Pam, does that look okay? All right. Okay. Sometimes I never quite know if I'm getting what I need here. Let me get one more thing and then we will be good to start. Aha. Okay. Pam, can you tell me, can you see my little arrow mouse floating around?
Yep. Sure
okay.
Can.
All right. We are set now. Okay. And I have all of your videos turned off. I can't see me or you at the moment, so I won't see you raising your hand. So either put your question in the chat box or write it down so you remember it at the end. Okay. All right. My name is Denise Schwartz. I'm a physical therapist and I own the Manual Touch Physical Therapy in Wheeling, which is at near the corner of Milwaukee and Dundee Road. So I know a lot of you are members of the Northbrook YMCA or live in the Northbrook area. So I'm like the absolute border of Northbrook and Wheeling. So very close. The majority of my patients come from the Northbrook Glenview area. It's very easy to get here. So I've been a physical therapist for a very long time, over 30 years. When I first got out of school in 1988, oh, hold on, I want to do this. Here we go. In 1988, I knew that, so you're here today, we're going to talk about hip pain, but I address a lot of other issues. So when I got out of school, I knew that back pain was the #1 reason people went to see their doctors. So I took a lot of classes to become an expert in taking care of back pain. And along the way, I took other kinds of classes as well to address all sorts of issues: shoulder pain, hip pain, foot pain, etc. Initially, I went to what we would call more of a traditional type of physical therapy, which is more of like, if anybody's been to therapy, it's kind of like, oh, this is where you hurt. Let's work on that problem and fix it. along the way, there were times where I couldn't find it and fix it for people. So I started studying some non-traditional physical therapy, which really looks at the whole body and where could be contributing to that painful spot. So a lot of times someone might come in with back pain or hip pain, and it's because their foot or their ankle doesn't move the way we need it to. And so then your back has to be overused or your hip is overused, and then you develop a problem there. So we're always looking for where are all the little kinks and tentacles that are being attached to that problem, kind of like a garden hose. You know, the water's not coming out at the end 50 feet away, but it's not the problem. It's not at the end of the hose. It's somewhere along the line of that hose. And it could be right where it's attached. So we always have to look for those things. So I started studying some non-traditional therapy, two kinds. One, exercise-wise, which really looks at a very functional approach of what area is limiting this specific spot from healing, what is not working, what is working, what area is tight, what area is too mobile, etc. What's weak, what's not weak. So we're looking for all those pieces and how it all feeds into it. The other kind of non-traditional therapy I learned was a manual hands-on type of therapy that uses a very whole body approach of, with our hands, finding where in your body that might not be healing, that might be preventing you from your painful area from healing. So we're looking at different techniques, not only on the muscles and bones and ligaments, but all the fascial tissue that surrounds all of our structures in our body. Where could it be wrapped around? The easiest example I can tell you is if people come in with back pain or hip pain, you might think it's your hip because it's in the back of your hip. But what sits in front of your back? Your gut, right here, your abdominals. So it's not just the muscles, but you have a lot of gut structures in there. So a lot of people who have a gut problem, ulcerative colitis, IBS, whatever, and they always have inflammation in there. Those people almost always have pain in their back or their hip. And so we need to work on those deeper structures in there, working on the fascial tissues around it to release anything. So then the inflammation can come down and we can address strengthening up your back or your hip. So as I learned this non-traditional technique, I wound up leaving. I used to work at Lutheran General, and I worked there for 14 years. And then I left the hospital to work for the company called Center for Integrative Manual Therapy, doing this holistic body hands-on approach. And I worked for them, I think 7 years. I get confused lately. But at any rate, I worked for them for about 7 years. We saw a lot of complex patients who don't get better elsewhere, and really addressing some of those deeper issues that just aren't being addressed in traditional medicine or traditional physical therapy. And then we parted ways in 2010, and I became my own practice, the Manual Touch Physical Therapy. What I realized is when I started learning that non-traditional work, I sort of abandoned a lot of the traditional techniques. And I realized I actually missed that. And there is a lot of value to some traditional therapy. So what my philosophy is now is using a whole body approach, using a combination of traditional and non-traditional therapy to get people back doing the things they love to do. Along the way, I had developed a passion for running. And so I went to a lot of classes and did a lot of study and certifications to become an expert in treating runners and triathletes as well. I am no longer a runner the last couple of years. As I got older, I developed arthritis in my big toes and wound up having surgery last year on both of them. And I kind of lost interest in it, but I don't want to push it. So I'm done running, but I still work with them. Okay, I think that's about me. And I have another therapist here named Kevin. Kevin and I used to work together at the hospital, and then, I left and he joined up with me a couple of years ago, and he shares my philosophy as well. All right. So we're here to talk about hip pain. Now, normally, if we were in person, and maybe one day soon we'll be able to do that, I would probably take a poll. How many of you have hip pain? And then I would ask you, where do you feel your hip pain? And people associate their hip with a few different areas. Some people call pain in their butt their hip. Some people call it their butt. Some people call it their back. People will have pain in the front of their hip. They might have it down their groin or on the side. So that's very important. That helps discern what probably is going on in that area and what might be causing the pain. I think I was talking to George earlier, and he's like, I don't know if this is my back or my hip. And so these are a first initial way we might determine where we might have a clue what's going on. Where is it coming from? And then common complaints people will tell me, they hurt, particularly if it's, the front of the hip or the back of the hip or your back might hurt when you're sitting. Some people, when they're standing, they have pain in any of those places, the front, back, or side of the hip. Walking, laying on my side, usually it hurts laying on their side, on that particular side. When people tell me that and it hurts to lay on that side, it's real spot specific on the side of their hip. It's usually something coming from a bursa or a tendon on the side of the hip there. And we'll talk about that in a little bit. As we get older, we lose some of the fluid and the natural cushioning around our bones and joints. And so we start getting achy when we lay on things. And so I don't remember if I address it, but I'll talk about it now. Sometimes your mattress is the problem. We need a little more cushion as we get older to kind of absorb all of our bony landmarks. And even if someone is kind of heavy or even obese, laying on your side, that bony area is still pretty superficial. So if the mattress is too firm, that could be a problem. People have difficulty putting on their shoes and socks. They can't bring their foot across their knee to put on their shoe and sock. That's kind of a big indicator it's the hip. But again, is it the hip joint or is it the muscles around the hip? And then if they have pain going down their leg, when they do that, that's a little bit more sciatic. So it could be from the back. It hurts. People tell me it hurts when they bend down or squat. They can't play or do the activities they normally like to do. Rolling over in bed could be a problem. So some simple things like rolling over a bed, or you sit for a half hour or an hour, you're watching a movie, or you're sitting in the car and you go to stand up and your first step is like, oh my God, that really hurts, particularly in the front of the hip. Moving your leg out of the car, getting out of the car could be a problem. So all those things give us clues as to what might be causing the problem and how we can address it. And those will be our goals. We'll know that we've resolved your issue or have managed the issue well when it doesn't hurt anymore when you move your foot or your leg out of the car, or when you roll over in bed, or I can go back and play pickleball. I'd love to know how many people are playing pickleball in the group, because we're getting lots of injuries with pickleball these days and people are just loving it. So anyway, for some tips, this is an ebook I have that you can, if you leave your email in the chat box, I'll be happy to send you a copy of this ebook, which will tell you how to move throughout the day so you don't aggravate yourself and don't continually injure that area. Okay, so now the next part of the talk here is we're going to talk about some anatomy around the hip and what we're looking for, and then we're going to get into the three most common causes of hip pain: arthritis or degenerative joint disease, weakness, a tendinitis or bursitis. This weakness is tough. People don't quite have difficulty understanding that. They know that they're weak, but just being weak when you don't use your muscles the correct way will cause pain. And we always want a diagnosis. We want to see it on a picture. We want to have an MRI and we want x-rays. And you know what? We will never see that anywhere. I get people with postural changes and muscle weakness on one side compared to the other. And that is actually what's causing your pain. So I know that's a tough thing to understand, but we do see it a lot, and there's absolutely nothing that we'll see on pictures. And we'll get more into that. All right, so let's talk about your hip. This is a view. Anterior means the front. So if I'm looking at you from the front, it's a front view of the hip. Let's look at the bony side first. So this is your left hip. If we're looking, we got rid of all your gut, got rid of the colon and all the muscles here, we would see your spine. Okay, that's the inside of your spine. These blue areas are the discs between each vertebrae. This big bone around is your pelvis. And actually the pelvis is made up of 3 bones, but that get fused together. I don't remember if it fuses in utero or afterwards. I can't remember, but essentially this is your ilium. Okay, right here is the pubic bone, and then down here is the ischium. I may have to have my designer add those 2 names to this picture. And if you'd like this a PDF of this PowerPoint, again, put your email in the chat box and I'd be happy to send it to you. Okay, so we got the ilium. This is your pelvis. This is your long thigh bone known as your femur. This is known as the neck of the femur. And then this is the femoral head right in here. It looks like a ball, and it sits in a socket in the ilium called your acetabulum. So this is a ball and socket joint. Your shoulder is also a ball and socket joint. And what that means is that hip or shoulder can move in all sorts of directions. And so both of those joints are very vulnerable because there's so much movement that it can have that you can wear away this joint in all sorts of areas. So it's a much more unstable joint, and it's so important to keep yourself strong around the hips and your shoulders. I think next month I'm doing a talk on shoulders, and so we'll address that as well. Okay, so oftentimes when, I don't think I put in there a fracture, when people fracture their hip, they usually fracture right in here, the femoral neck. Some people, what happens is they get older, they fall down and they break their hip. But what really most of the time happens is your hip, this femoral neck breaks, and then you fall down because you can't stand on your leg. So I know that sounds a little odd. Why would this all of a sudden just break just like that? Well, if somebody has osteoporosis or a weakening of the bone tissue here, and the integrity of the tissue is not good, and you've got muscular imbalances all around it that are pulling and stressing and straining on the area, it can just break, and then you fall down because you can't stand on the leg. Okay. Now, when people have hip degeneration, that is in the joint here. Okay. And what they'll do is they'll see on x-ray. So normally, I think you can see my hands. Let me see here. Let me take a look at myself here. Okay, good. All right. So normally you can see how there's a space between the ball and the socket. At some point, the soft tissue, the cartilage in those joints wear away, and the space between the bones become narrower. And what'll happen is, you might get more narrower down below, or in here, or in here. And when you go to move your leg, that hip rubs against the bone, and it's very painful. Okay. People, when this hip joint is the problem, one of the first telltale signs is you will have pain in the groin area, which would be down in here or along here. Okay. By the time you get there, that hip joint is probably pretty well degenerated. Now, before you get all scared, sometimes you can have groin pain and it's not your hip joint, and it's just a soft tissue problem there. And we'll talk about that in a little bit. Those are things that we want to discern. The other thing that we see with arthritis, when someone comes in to see me, what we do is I assess the mobility of that hip joint. And how do I do that? When you lay on your back, I lift up your leg, you know, bent at a 90 degree angle, and I rotate it. It shouldn't hurt, okay? But if I can't move it one direction or the other because it's really almost stuck, that's a sign. I'm going to send you in to get an x-ray from your doctor to see how much degeneration is in that hip. We can tell when we're assessing that joint, is it being stopped by bone or is it by soft tissue? So if you look at my fingers, I can't extend them up, but if I do this, see how I can extend up? Because that joint allows that movement. It's just not a natural movement, but it kind of bounces, you know, it has some give, it has some shock absorption. That's what we want in our joints. But when I assess that and I'm holding your leg and turning it and it doesn't want to go the one way, and if there's no good bounce there, then there's a good possibility there's something going on in the joint. So then we know it's arthritis, possibly arthritis or degenerative joint disease. Okay, so now let's look at the muscles that surround the front of the hip. This long muscle that goes, actually attaches to your spine, and it comes through the middle of your body, and it actually sort of looks like a pork loin, and it attaches on your femur here. This is known as your hip flexor muscle. I guess I need to get him to mark what the names of these muscles are too. Okay, anyway, so this is your, also, it's known as your psoas, P-S-O-A-S. It flexes your hip. It also is part of your core muscles. We'll talk about that in a minute. This is a very long muscle here. Okay, in here on the front of that ilium is your iliacus. Down here are some of your pelvic floor muscles, which I think we'll see on another slide. These are the adductors, your hip adductors. Those are the ones that move your leg into your body, okay? And they attach here on that pubic bone. You know, we might get somebody in here when they fall and they break this bone, you know, so you're going to get pain in that groin area as well. A big complaint where we know, or we can probably figure out that it's this hip flexor muscle, is when people sit and then when they go to stand up after a half hour or more, it hurts in the front of their hip. It hurts to sit in the car, you know, get out of the car. A lot of times it's this muscle. So we're going to work on retraining that muscle to work on working out the kinks in there, getting some better balance. Okay, so now this is, hold on a second. Anyway, all right, so now this is the posterior hip, which means it's looking from behind. Okay, so here when you look in the front, I pointed out the vertebrae. Down here is called your sacrum, and that's your tailbone called your coccyx. When we look at the back end, here's just a little bit of the sacrum. And then this is the back end of the ilium and the back end of the femur. On your butt here, we have a big, there's three glute muscles, your glute maximus, your medius, and your minimus, okay? The maximus is torn off of this poor skeleton here, and that's your power. The glute max is your power. It uses, you know, for jumping and powerlifting. What we're really most concerned with is this glute medius muscle. Let me see. And this glute medius, which is torn off here, attaches down here in the back end of the femur, okay? And that's the muscle that allows you to stand on one leg. That's the muscle that we need you to activate when you're walking. That's the one that we need you to get to stabilize on. And that's the first thing to go when you have a problem. Whether you have a back pain, or hip pain, or ankle, you sprain your ankle, that muscle gets weak. You have a foot problem, this is the muscle that goes. This is the biggest deal that we need to work on, is to activate this muscle to get this stronger to protect the rest of you. This is your piriformis, and these are deep pelvic floor muscles that probably nobody's ever heard of. The gemelli brothers, we call them, the gemellus superior and inferior, and you got the quadratus femoris. This is part of your deep core. And I'm sure a lot of you have heard of your core. That is all of the muscles that start at your diaphragm and then ends at the pelvic floor. If any piece of that core muscle, you got your superficial, your I think I had to add a picture in here. Oh, I do. All right, here's your core. So your diaphragm is up in here. Here's your pelvic floor down in here. This is the superficial six-pack muscle, which looks like this, but we may not see it because we have all sorts of fat and other stuff on top of it, but everybody has it. It's called your rectus abdominis. And then we got angled muscles called your obliques. They go this way and different angles, this way and this way, and they help stabilize. Those are the superficial. Then you got your deep muscles. You got your transverse abdominis muscle in here, and then you got those deep pelvic floor muscles. Okay. This transverse abdominis muscle goes all the way around the front of your abdomen, all the way around your back. So when you're in your class, your exercise class, and they say engage your abdominals, this is what we want you to do. I have a little trick I'm going to teach you now. And again, I have a video of this on my website and my YouTube channel. And again, if you leave me your email, I'll send you the video as well on how to engage your transverse abdominis. You put your tongue on the back of your top teeth and make a TH sound. So go ahead and give that a try. You can put your hands on your abdominals and you'll feel how it'll pull in just subtly. If you can make the sound, then you are engaging that muscle. During my career, I've worked in nursing homes, and I found that a lot of my seniors could not make that sound because they couldn't engage this muscle at all. It was so weak. So if you can't make that TH sound, then you're really dealing with a really weak transverse abdominis here, which then can set you up for a problem anywhere. All right, where are we? Okay, and then we talked about the pelvic floor. Those are your deep core muscles. When you do that that'll help pull that in as well. I have to tell you, 9 times out of 10, when people come into my clinic, whether it's hip pain, shoulder pain, foot pain, ankle pain, back pain, they have a weak core and pelvic floor. I get a lot of women who come in with hip pain that they weren't able to get fixed elsewhere because the therapist didn't look at the pelvic floor. This is their problem. And this is the case of where, remember I talked about how weakness doesn't show up on any pictures? That's what we're dealing with. So for example, one of my best friends had hip pain. She had been walking a lot during the pandemic. She started doing an hour in the morning, an hour at night. And interesting enough, one of the walks, she was walking with her sister, who was a foot taller than her. You know, she's 5'5" and her sister's 6 feet tall. So she was keeping up with her sister, taking longer strides than she normally would. And then she strained her hip. You know, we could poke around in there and probably we get some tenderness here, but if we're not strengthening this pelvic floor, then this can't work well. And so that was her problem. She didn't get better doing other things. And so she came in, I did an assessment. This was weak. I gave her specific exercises to strengthen here and to do what we call neuromuscular re-education exercises to teach your body how to activate these muscles so it can protect your pelvis and stabilize. So when you stand on that leg, these muscles can activate appropriately. The other thing we had to do with hers, because I had her and I had one other woman who came in with the same pain, and they both were the other woman, her husband was 6'5" or something like that. And so she was trying to keep up with him. And so she overstrained these muscles, and these were not strong enough to support her. So then she strained this muscle. So both women, in addition to re-educating these muscles to activate and strengthening, we had to talk about how to shorten her stride, possibly take more steps in relation to the taller person's steps, or you tell the taller person, slow down, walk at my pace, or you just don't walk with the taller person, or you walk behind them, because you can't do more than what your body's capable of doing. Okay, so what we've addressed, I've talked about arthritis, I've talked about weakness, let's see, tendinitis and bursitis. Okay, so I do say 9 times out of 10, this is the reason you got your problem. And the problem could be a tendinitis where that means a tendon is inflamed. You see this white area that attaches to the bone? That's your tendon. A tendon attaches your muscle belly to the bone. And this gets stressed or strained or inflamed. And so you strain the muscle, and then we call it tendinitis. It's very common to have a glute medius tendinitis here. Okay. Some people get this piriformis tendinitis, although it's very common in the literature to talk about this piriformis being the problem. I actually don't find that very often. They may have pain or tenderness there, but it's because of these deep muscles again. So I always hesitate to say that it's piriformis syndrome, because it's almost always a pelvic floor weakness or a core weakness. Here we talked about the psoas. That would be a hip flexor tendinitis in there. Glute medius tendinitis, hip flexor. What else I'm trying? I'm sure there's something else. You might have a tendinitis in the adductor here in the groin. All right, so we call it an adductor tendinitis. You might get sometimes people have muscle pain up in their abdomen, and that really freaks people out, and they do all sorts of tests. I even got a guy 5 years later after he developed pain in his abdomen, and they took his gallbladder out. He had ultrasounds, he had blah, blah, blah. His problem was he had strained an abdominal muscle because he had been putting in a wood floor, overusing this rotation motion, which actually strained something up in his back, and it pulled the muscle in his abdomen. So I know it's really freaky when you get a pain here in this abdomen. You know, how do we discern? And that's another important point. How do we discern? Is it muscular? Is it bony? Is it something that we can take care of it? Or is it something, internal? Is it actual nerve related? Is it gallbladder? Is it colon? So what we want to look for is the pain reproducible. Okay. So when you come into my clinic or you see the doctor, if you tell me, when I sit down, my pain goes away. When I lay down, my hip goes away. Oh, if I lay on my side, I feel okay. That means we can reproduce it typically. You can find a comfortable position. If I do a certain muscle test or I poke around somewhere and, oh, that's it, we reproduced it. When isn't it reproducible? 5 years ago, I developed some SI pain, and I haven't talked about that yet. I'm going to talk about that in a minute. This is the back of your pelvis. This is your sacrum. This is the ilium. So this is your SI joint. I developed some pain back here. I'm pretty lucky I don't have back pain on a typical basis. So I was like, I don't remember doing anything. I went out for my run. It didn't make it worse, didn't make it better. 2 days later, it was really getting bad, and it was radiating around to the front of my abdomen. I had a friend of mine work on me, and when we work on each other, we're not as conscientious as when you're a real patient. So we did, tried to fix it. It didn't work. By the 4th day, I could not find a position to sleep. it hurt all the way around. It was just this dull, achy, gnawing pain that was not reproducible. So I knew it was something worse. So I said to my husband, I need to go to the hospital. Something's going on. And because it was back here, they assumed, or they were looking for kidney stone, kidney, bladder infection, etc. But I went in and I said, it's not reproducible. This is not musculoskeletal. They did all their tests, 2 a.m. It must be musculoskeletal. They gave me Vicodin and sent me home. I was too tired to argue. And, you know, when you're a patient, even if I'm a medical professional, you sort of lose objectivity. So I started with this pain on a Monday. I guess 8 days later on a Tuesday, I scratched my back and I had a rash. I had shingles. I had shingles pain before the rash showed up. It's very hard to diagnose. You know, if it looks like a zebra, then it's a zebra. Or what is it? I get it confused. There's a saying, you know, are we finding the zebra or is it just a horse? You know, they just didn't go there. So I got the antiviral and I cleared up. Interestingly enough, so this is 5 years ago. 2 years ago, my back was itching right here, and my doctor's like, oh, it's probably some shingles pain or symptoms coming back. I took the antiviral, it went away within a couple days. Just a few weeks ago, I had what I would call sciatic pain on the side of my calf. And again, I'm like, I don't know what I did or where that came from. It made no sense. I don't normally have sciatic. Kevin worked on me. It felt a little better, but then it was still there. And I later in the day, I wasn't doing anything. You know, I was washing dishes or something. I'm like, oh, this is shingles pain again. I took my antiviral and it went away in a few days. Now, that's not for you to do that, but it's to kind of recognize that sometimes what seems like typical sciatic pain could be something else. Typical abdominal pain could be something else. So we are always looking for those pieces and making sure that it's really true musculoskeletal and that we can help you. Okay, the last piece here, I didn't talk about tendinitis. I just wanted to address your back real quickly. I'll be doing a back pain talk, I think in a couple months. You can come to that, but here is your spine, the vertebrae. This is that ilium. This is your sciatic nerve, comes out of the spine and it goes down the back of your leg. And it goes behind your hip and in between muscles here, okay? So sometimes you'll have pain in your calf or the back of your thigh, and that's sciatic pain, okay? Now, is it coming from here up in your back? Is it being impinged between these muscles? Is this SI joint a problem? So we're going to look for all those pieces. So sometimes people come in and says, my hip hurts. And if they're pointing to back here, I usually think it's an SI joint problem most of the time, okay? And then I do some hands-on work to get that balanced out. And then the strain of those muscles pressing on the nerve, the pain will go away. For another talk, we can talk about, you know, all the, what else could cause sciatic pain. Okay, I think I talked, all right. So now here's some screens. So this is where if you get the, you know, if you leave me your email, I'll send you the PDF of this PowerPoint. So when you notice these things, people, just to reiterate what I said before, if we think it's arthritis or degenerative joint disease, or there's something going on in the hip joint, you might have groin pain. You'll have loss of mobility in the hip that you may not notice, except, oh, you'll say, oh, I can't put my shoe and sock on, or it's hard to get my leg in the car. And then we'll notice when we assess that. Weakness, a noticeable limp, a change in your gait. I think I have yeah, probably nice to put in a video of somebody. I had this poor woman, younger than me, 52 maybe, and she came in and was walking really funky. And I knew right away it was something going on in her hip joints. And she was like, oh, I just think I have a hip impingement. And I'm like, no, I think you need to go to a surgeon now. I think your hip joints are a problem. She resisted, but she finally went and she just got both hips replaced. You know, when you're 52, usually it's because if you hadn't had a major injury, you were born with, you know, a problem in your hip joint, what they call hip dysplasia. And so it tends to wear away a lot earlier. And so you need a hip replacement sooner than later. Low back pain. I had another woman who came in. I think she saw a chiropractor for many, many years, took care of her back pain, took care of it, and then he couldn't do anything anymore. It wasn't working. And so a friend of hers recommended me. She came in and it was her SI pain. And I think within a couple of visits, I'm like, you know, I think this might be your hip joint. And she again resisted me. And I'm like, no, you need to go get an x-ray. Sure enough, a few months later, she had her hip replaced. The unfortunate piece is when it gets too bad and it just hurts badly in that hip joint, there isn't a lot we can do, and you really need to get it replaced. It's very hard to live with a hip joint that needs to be replaced. You know, in the beginning stages, you know, if there may be things that we can do to, you know, strengthen it up, maybe prevent it from getting worse sooner than later. But if it's at a point where it's like in your groin all the time, and it hurts all the time, and we see on the x-ray that it doesn't look good, then you probably need it replaced. All right, this is a reiteration of if it's weak, you have a hip weakness, or postural weaknesses, we're going to look for these areas. The foot plays a big role in activating your hip and your core to function when you're moving. So we're going to work on exercises to get those working together, what we call neuromuscular control. This is a picture you can see special to women. Our hips are wider than men, and often as a result, our knees, we have what's called a Q angle that's wider or more acute. And so it lends itself. This woman had both her knees replaced. As you can see, she put a lot of stress on her knees because her natural gait and stance was like this. And I saw her after she had her, you know, it was too late. But we would work on, I just had a woman just in earlier that we worked on walking. So your feet aren't so close together, have her feet further apart when she walks. So this line becomes a little bit straighter, like here, okay? These are all the different things you can get with tendinitis or bursitis. I see here what I forgot to talk about is that IT band, which is a band of tissue that runs down the side of your thigh, and it attaches over here. And I think it's missing here, but there's a muscle under here above this hip joint area called your TFL. I think I have a new picture that I just didn't put in here. I'm sorry. I'm going to have to update my PowerPoint. But anyway, that's called your TFL, tensor fascia lata. And that's like if you have a deep hip, like right here, and I poke in that area, but you come in and you tell me you get pain on the side of your knee, that's IT band pain, but it's often caused because this muscle is tight. I talked to you about reproducible, and we want to know if we can reduce it. Okay, what's very important to know is what is the diagnosis, because that'll dictate what we're going to give you treatment-wise. Do we need to send you to the doctor? Or have you seen the doctor already? Did they not take a hip x-ray? Did they just do back, etc.? We need to figure those things out. Okay. What is the biggest mistake people make with hip pain? They ignore it. So I was talking to George when I first came on, and he said he's had hip pain for the last 2 weeks. So hopefully I've answered his questions, or he has some clue as to what's going on and what he needs to do. This is a lady who had some bad hip pain, and after seeing us here in the clinic for a while, she was eventually able to walk and get back to this was before the pandemic, go downtown and walk and go to the museum. So she was very happy. I think this was my friend writing this down, where she had a lot of pain, and because, I don't know, she went to see a traditional therapist who missed that the pelvic floor was the problem. And then once I gave her the right exercises, she's been great since. So what happens when you come in to see physical therapy? I talked about the different traditional and non-traditional manual therapies we do. That's a hands-on. We're going to do some exercises to strengthen up your core, legs, feet. We want to make sure you have the right amount of mobility that you need to move. And then most importantly, in the neuromuscular reeducation, to really get your feet and your core and everything working together well. So because you came here on this webinar, I'd be happy to talk to you about your problem. If you have like a specific problem that's difficult to answer during this time, I would ask that you give my office a call and schedule a time to talk to me or Kevin, and we can go over what we think is going on and what we'd recommend you to do. If you have a nice general question, I'd be happy to answer those in right now in a minute. These are some links to some blog posts that I wrote that will address some of these questions as well. Again, here's that ebook, and here's how to reach me. Now, I don't know, I saw on, if you have Medicare, we are a Medicare provider, which means physical therapy, we bill Medicare and your physical therapy is covered by Medicare. You do need a prescription from your doctor for physical therapy if you have Medicare. You might, if you have a good relationship with your doctor, you might be able to email your doctor and say, gosh, I'm having hip pain. I'd like to go to physical therapy. Can you fax over a script for me? And they might send the script over without having you to go in. But if they haven't seen you in a while, then they're liable. So they often want to see you. Sometimes it just makes more sense to come in here first, that way before we do MRIs and x-rays, et cetera. So we save the radiation and the cost, et cetera, because we usually can determine whether we need to do some more testing once you come in. I also take Blue Cross, and we bill other insurances as well. Just give our office a call. Like if you have friends who are not Medicare and they're having problems, you know, we see a lot of women with hip pain. It's very common, particularly in my age group in their 50s. Okay, I think I'm going to stop sharing the PowerPoint, and we have a little bit, about 5 minutes or so, that we can talk, answer some questions. Let me see if there's some in the chat box here. What about bursitis? Oh, I did forget to mention bursitis, didn't I? So bursitis is usually on the side of the hip. So remember that picture I showed you of the hip and how it comes out on a little angle and then down right on the side there? That's where usually the bursitis is, and it's called greater trochanteric bursitis. Bursa is a fluid-filled sac, kind of like a pillow, and it protects the bone. And I think the fluid decreases as we get older, so we're more apt to get the bursitis. When people hurt when they just lay on their hip, that's all they have. It's often just a bursitis there, and we do some manual techniques to reduce that as well. How does a C-section affect these muscles as women's age? Well, you know, when women have a C-section, you not only have scar tissue down in the bottom of the pelvis, even though you didn't have the vaginal birth where the pelvic floor muscles are really stretched out, the pressure of the baby, or if you're heavy, pressing on the bottom of your pelvic floor will cause weakness in that pelvic floor and thus can set you up for problems anywhere. I'm not sure if that answers it or not, but any woman who's been pregnant, whether they had a C-section or vaginal birth, they often have a problem in their deep core muscles that we have to look at. Okay. Are there any other questions? And I see it, just a few people put their email in there. If you put I think Pam has your email. If you just say maybe yes in the chat box, Pam, what do you think? Then you can give me their email. What do you think? Does that work for you?
Sure.
Oh, someone asked, pain from the hip joint down the front of the thigh. It could be coming from the quad muscle, which I think I forgot to talk about, which goes in the front of the hip. So sometimes it could be from the quad. If it hurts when you're walking, like after 5 or 10 minutes of standing or walking, oftentimes that's coming from your back and it's a stenosis problem, particularly if it's on both sides. How much time with every visit? We see people one-on-one for an hour. If we don't need an hour, we'll see you less, but it's usually an hour. Okay. Any other questions?
All right. Thank you, everyone. This concludes our YMCA Education Series talk. On behalf of the YMCA and North Suburban YMCA and YES, we thank you for supporting organizations and programs like this. Special thank you to Denise for speaking with us today. You can check out more programs at our website online, nsymca.org. Denise's next talk will be Thursday, April 21st, Healing Shoulder Pain Naturally at noon. You can register online right now and heal your shoulder pain and enjoy life again. Our next talk will be tonight at 7 p.m. What is metabolic health? So that is tonight at 7 p.m. Thank you, everyone, and have a great day.
Thank you so much, everyone. Bye.
Bye.
Thank you.